The thing about birth control is that there are lots and lots and lots of choices. And the goal is to find the choice that's going to be best for you in your short-term reproductive goals and your long-term reproductive goals. And I find that a lot of women get frustrated because it can be so overwhelming. They don't know how to conceptualize what's going to be best for them. So one way I like to look at birth control is I like to put it in two categories. A category with just that contains estrogen and progesterone both, and a category with just progesterone. And I found that women that want to have a regular period and know when their period's coming and try and hopefully not have too much bleeding between their periods, a birth control method with both estrogen and progesterone is more likely to get them that result. On the other hand, if they're looking for a birth control that maybe lasts a little longer for several years, something that they don't have to worry about on a daily or a weekly basis changing, then something with just progesterone like an implant or an intrauterine device might be a better option for them. The best thing they can do is get themselves into the best health they can. So regular exercise, get their diet under control in terms of portion, in terms of lots of fruits and vegetables, a healthy diet. And when it comes time to stop their birth control, they stop their birth control, start a prenatal vitamin if they're not already doing so, and then they try for pregnancy. And that's the best way that they can kind of get themselves into the majority of circumstances ready for a healthy pregnancy. It's a matter of always trying to keep something in your stomach. And we call it morning sickness for no other reason than it's worse in the morning, and the only thing that changes then is because your stomach is empty. So if you can get something in your stomach and keep something there, I think that's a huge difference on nausea and vomiting of pregnancy. There certainly are medications that we can use, and we use those quite often. It's one of those annoying parts of pregnancy, but one of those parts of pregnancy that are easily fixed for the most part for the majority of patients. I think it comes down to eating regularly, keeping your stomach with something in it, avoiding spicy foods, high fat foods sometimes can aggravate that as well, and then using the medicine if we need to. I think, and this comes into why I even became an obstetrician, and if you think about other areas of medicine, I can't think of one that a doctor is more involved in life-changing events than the birth of a baby and taking care of that mother and family through the prenatal care course and at the delivery. And I always wanted to be a part of that. And it's kind of a privilege for a physician to be part of that life-changing event. And I think that's what drew me to obstetrics in the first place, was being part of creations of families and growth of families, and helping mothers and fathers alike through that transition phase is very, very rewarding. I can't think of another area of medicine that's quite equal to that.